met before. My name is Dr. Jared. I'm the founder of our clinic here. I do want to first appreciate your time. I know that everybody took time out of their night to be here. I do appreciate that about you. This initial information that I'll share with you tonight applies to everyone. What I'll be showing you are both normal and abnormal x-rays up here on the view box. Now, they're not your x-rays quite yet, but what they are patients of ours who have given us permission to show you. So when we break up privately, either with myself or with Dr. Alex or Dr. Kyle, you're going to know, number one, exactly what you're looking at, but more importantly, how that affects you and your health. Because I will say, as we've gone through this, the top 3 reasons that somebody goes to see a chiropractor are pain-related, if you pick the averages. Headaches, neck pain, and back pain, top 3 reasons that somebody seeks out chiropractic treatment. So it does surprise a lot of people when their blood pressure goes down, or their immune system goes up, or their acid reflux goes away, or things that you might not normally think of related to pain, but they are related to your nerve system, and the kind of treatment that we do here puts lens on that. I will tell you, not only do we see this in our clinic every single day, but at the same time, the first time I went to see a chiropractor was not for pain, it was actually for asthma. Not asthma I had my entire life, but asthma that I developed after a weightlifting accident. I grew up in Freeport. I was at the Freeport YMCA, had a friend of mine drop a 125-pound weight bar right on my face. That hit hard enough that you can imagine what happened. It broke 7 bones on the left side here, bounced, I have a scar on my forehead, was put in an ambulance, went to the hospital. Within a week, they put titanium through the entire left side, and then over here at Rockford Memorial, a plastic surgeon spent about 6 hours just trying to make that look normal again. I would say I think you did a pretty good job. Never had anybody notice. It's all fake. It's all reconstructed. In fact, it didn't take that long to look normal. Within about 3 weeks, the scars had faded, the bruises had healed. I looked fine, felt fine, and I actually considered myself lucky because I thought I'll never deal with another issue from this. And I didn't for quite a while. It took about 4 months. 4 months from that initial accident, had the very first asthma attack I'd ever had in my life. Now, I did what most people do. If you have an asthma attack, you go to the doctor, got asthma meds, felt fine. It covered up the symptom, no problem. But it started this process where my health started to decline, and over the next 4 months, ended up going to 11 different specialists, always looking for the cause of the problem. And they could give me meds. I started to have sinus problems. I got sinus medication, but it just never fixed it. It was the 12th doctor that I went to see was the very first one that gave me long-term relief, and it was also the very first chiropractor. Now, I had never been to a chiropractor before. Like many people, it was a little bit different than the doctors I'd been to in the past. And what they said was, it was a little bit different, was we're not just going to try and help you feel better, but really allow your body to heal itself so that it is a long-term change, or really a permanent change, ideally. When I went in, like so many of you would have had, I had x-rays of my spine. Now, this normal 45-degree curve that you absolutely have to have, from that accident, mine had actually reversed. -11 was the position of my spine when the chiropractor took my first x-rays. And even though it had been like that for months, it took all that time for that pressure to sit there before I had any sort of a symptom. More than 8 months before there was even a twinge of any sort of pain. And the reason I say that is if you think about it, while we do have the best doctors in the world, we have the top-ranked prescriptions, we have the most availability of any medical technology out there, at the same time, we have the most chronic disease. We have the most medication consumption. We have the most of these things that affect people for life. And I can tell you it's been more than 10 years now since I ever had to take a medication, since I started to get adjusted. But think about if you took the exact same person, if I had never gone to that 12th doctor, if I had never corrected it, for the last 12 years, taking those medications all that time, even though I could be standing before you today and feel okay, think about which person's truly healthier. Think about the side effects of all those things the longer that you take them. It's not to say that nobody ever needs a medication, and in fact, they can be life-saving. If you have a heart attack, if you have a stroke, if you're in a car accident, absolutely life-saving, but they don't necessarily correct it, and every single one has side effects. And so that's why when we look at your spine tonight, we'll look at more than just what might cause you pain, but really work to help you be considerably healthier. If you look at that word health, it means different things to different people, but I can tell you, most people judge their health based on that. They judge their health based on how they feel. Now, certainly, everybody deserves to feel great. If you are sitting here tonight and your back hurts, if your neck hurts, if you do get a headache, believe me, that's the very first thing that we're focused on. But beyond that, if you look in any medical dictionary, they don't necessarily talk about how you feel, but your body's ability to heal and function is truly what makes you healthier. 100% would be perfect health, 0% would therefore be death. For you to have back pain, neck pain, headaches, whatever it might be, just to feel a symptom, on average, you have to lose 40% of the function before you'll feel it. 40% lost before you can have that. And you know, deep down, most people here already know that, because think about the major diseases. How long does it take to have a heart attack? How long does cancer have to grow in your body before you actually see it on a screening test? How long do you have to have high blood sugar or diabetes before you get any sort of a symptom? Now, just like those very serious diseases, you don't feel them early. You also don't feel scoliosis starting. You don't feel your spine shift out of place. You don't feel arthritis or a disc bulging. And so that's why for you to be sitting here today hurting or having some other sort of a symptom, that person has to be somewhere down here before they ever feel it. Now, as you start to get adjusted, you'll start to feel better. But at the same time, if you think about it, this person, as you're feeling better, if they stopped right here, what would happen? Kept the same lifestyle, same hobby. What would you say there, Shirley? They go back, right? So it wouldn't take that long before this would shift back. Now instead, you know, beyond feeling good, we really work with what's called spinal correction. And what spinal correction is truly changing the shape of your spine so that it makes long-term results. So it truly makes a change for you. And so, you know, as we go through this tonight, as I get ready to show you x-rays here, everybody knows that a chiropractor works on your bones, but you work on the bones to work on the nerve system. Your brain sends messages right down the spinal cord, out the nerves. Your brain tells your heart to beat, your lungs to breathe, your stomach to digest. Yet if you think about how long does it take for somebody to cut the nerve going to their heart, how long would they live for?
30 seconds.
Yeah, not very long, right? Now, it's very rare to cut a nerve, not uncommon to pinch one. If you pinch a nerve in your neck, you might get neck pain. You might have trouble turning your head or feel like you hold your stress in your upper back. Same nerves go down into your arms and hands that cause things like numbness or tingling in your arms. Well, the same nerves that cause all those pain points are the same ones that affect how strongly your heart beats. They're the same ones that affect how well your lungs breathe. Middle of the neck, they go to your thyroid. They can affect your metabolism, your energy levels. This upper part of the neck, these nerves go to your sinuses. They can affect sinus and allergy issues, headaches, migraines, inner ear problems like ringing and dizziness. Same nerves also affect your sleep, and they affect your mood, specifically the serotonin release. For anybody that knows somebody with either anxiety or depression type issues, you know that serotonin is the hormone that helps you to feel good, that regulates your hormones, and your brainstem actually is what controls that. If everybody would for me, if you take your two fingers and find the bone just behind your ear, go ahead and try that. That soft spot right behind there, that's where your brainstem sits. So you actually have part of your brain that extends down into the spinal canal, and that's why you feel so many different symptoms if you have an injury to this area. The middle part of the back, they go to your stomach, things like reflux, indigestion, your liver, gallbladder, pancreas, and spleen. The lowest part of the back, that's actually the most common area to develop back pain as someone ages from wear and tear. Now these same nerves also branch off into the nerve called the sciatic. I would bet that many people have heard of sciatic nerve pain before, maybe have experienced it. Same nerves go to your digestive tract, your reproductive organs, adrenals, kidneys, bladder, and ferment the prostate. Now, anywhere that you pinch a nerve, you can feel pain. Anywhere that occurs. But at the same time, the reason why you don't feel pain for every single health issue is that only 10% of your nerves can feel. Only 10% of your nerves are sensory. The other 90% control the function right through here. And so you could have a pinched nerve in your back, and you could have severe back pain, or you could have a pinched nerve in your back, and it could affect your prostate. It just depends on what percentage of those nerves are being influenced. Now, as I've gone through this part, does any of this not make sense to anybody? I've never had somebody tell me it did, but I have had several people say, I've been to the chiropractor before, and they just told me to come back when it hurt, or how come when I went to my doctor, they didn't check this as well for me? What I'll show you, every doctor, pediatrician, orthopedist understands this at least at some level. A straight spine from the front is perfect, 45-degree curves from the side, that's completely normal. What can happen is if you lose this curve, if your spine shifts out of place, can you see what that would do to these nerves right here? Now this pinching, that pressure, that's going to cause a problem to wherever those nerves go. If you take this to an extreme, this is called scoliosis. I bet every single person here has heard of scoliosis before. Scoliosis is a medically diagnosable condition in every doctor's office in the world. In fact, if it's to a certain point, you'll have to have rods put in your back. Beyond that, they know that it's a medically diagnosable condition. If you went and got life insurance for your family or because you were worried about your health, this raises your rates just like high blood pressure, just like smoking, because it takes years off your life, and they know that. And it's not because of the bones, it's because of these. Now, I can guarantee you, if you look around the room today, you can't tell what somebody's health is purely by looking at them. Now, and that's why we take an x-ray, because an x-ray is a snapshot or a window right into your spine, into your overall health, and that's what I'll go through the last 15 minutes here, starting right at the top.